everyone. Welcome to the 4th International Agricultural Symposium of INSER. My name is Dr. Sergio Tamayo. Today we're going to talk about intramural fibroids. What's the real impact on fertility? A critical and still unsolved questions in this field is the relationship between fibroids and infertility. This issue is very important because in the developed world, there is a tendency to start family at an age when natural female fertility is in decline and the incidence of fibroids is increasing. So as a consequence, the proportion of infertile women diagnosed with fibroids is expected to rise, and obviously it's going to cause a negative effect on fertility. But this is not confirmed until now, so that's what we're going to talk in these slides. Our goals, or my purpose, is to show you how frequent it is, classify these fibroids, and understand the real impact of these fibroids on fertility. And at the end, see which one is the best decision when we have a patient with myomas or fibroids. So due to the patient's viable symptoms, this condition can be underdiagnosed. And also because until 20% of the patients are asymptomatic. So according to recently published data, about 7 to 8 out of 10 women will have a fibroid during their lifetime. But in overall, the rate does not seem to be more than 8 to 10% in patients from 30 to 40 years old. So it's also important that the prevalence of is higher in patients with infertility. So among women undergoing fertility treatments, more than 1 out of 4 patients is going to have fibroids. Although it is estimated that if all other causes of infertility are excluded from the diagnosis, fibroids might be just responsible for 2 to 3% of the cause of infertility patients. So knowing that this is the most common benign condition of the uterus, it's very important to know what to do with these patients. And also it's very important to tell you that the location and size is going to be relevant at the moment to take the clinical decision about what to do with these patients. So before we start talking about fibroids and fertility, it is necessary to make sure all of us are speaking the same language. So the classification, it can be like this, as you see in the picture. There are 3 major types of uterine fibroids. Intramural fibroids grow within the muscular uterine wall. Submucosal fibroids get into the uterine cavity, and subserosal fibroids project to the outside of the uterus. But the fecal classification is a little bit more deeply or more specific. And like the picture shows us, the submucosal can be 3 of them. The type 0, that is all of the 100% inside of the uterus. Type 1, it is less than 50% intramural. The rest is inside of the uterus. Type 2, it has to at least 50% intramural or more. And the other ones, intramural and subserosal, will be in the group of other groups of fibroids. So type 3 are 100% intramural but contacts the endometrium. Type 4, it is 100% intramural. And type 5 will be subserosal, but it has more than 50% intramural. Type 6 will be subserosal, but less than 50% intramural. Type 7 will be subserosal, the 100%, and type 8 will be these fibers that are not exactly in the uterus. It can be at the ligaments or in other parts. So knowing this, it will help us to do better studies and also know which one of those myomas we have to treat or not. Unfortunately, there's poor attention that has been paid to the mechanism through these fibers may cause infertility. So there's a lot of mechanisms by which fibers may reduce fertility, and there has been proposed in the past. This negative effect can be mediated by alteration in the uterine cavity, causing mechanical pressure, or by occurrence of abnormal uterine contractility. More than that, there's going to be like a local inflammation that can result in a hostile environment of the endometrium. And also this is going to impair the sperm transportation and the embryo implantation process. This implantation process results from the development of the embryo and also the endometrium, both at the same time, leading to the window of receptivity. So among these endometrial expressions that are associated with successful implantation are the OX genes, the OXA10 and the OXA11 appear to be the most important. So most women with deficient endometrial expression of OXA10 and OXA11 experience reduced implantation rates. So we can ask how fibroids impair endometrial receptivity. A potential mechanism by which fibroids may influence receptivity is altering this molecular expression, including the OXA10. As we're going to see in the next slide, available evidence has demonstrated reduced endometrial OXA10 expression in women with type 0, 1, and 2 fibroids. This finding appears to affect the endometrium globally, not just the endometrium overlying the fibroid. So this one obviously is going to affect the embryo implantation, and this doesn't happen with fibroids of type 3, 4, or more. So what does the evidence tell us about the impact of intramural fibroids on fertility? So this is very important to know before we talk about the actual evidence, because evidence linking fibroids and infertility is still controversial. Some difficulties can explain the lack of conclusive evidence. So like you see in the image, what came first, the chicken or the egg? There are many confounding factors which do not make it easy for us to clearly demonstrate the cause of this relationship. So infertile women most of the time doesn't have children. Having that in mind, and knowing that parity displays a remarkable protective effect on the development of fibroids, infertile women may be exposed to a higher risk of developing fibroids just because they don't have children. But also, the prevalence of fibroids increase with women's age. So knowing that the parity is associated with a reduction in the risk of fibroids, so it can be a protective factor, or fertility may be partly compromised in women with fibroids. So also fertility declines with women's age, as I told you before. This relationship is very relevant, knowing that in the modern trend in Western countries for women is to delay childbearing until their 30s or even 40s, an age which fibroids become more common. So other confounding factor is that fibroids are associated with gynecological conditions that can also cause infertility, such as endometriosis. Again, it may be difficult to discern whether fibroids have a direct detrimental effect, or conversely, whether the association with infertility is mediated by the presence of conditions that can cause or interfere with infertility. So in addition, study design are complicated by the fact that fibroids are a condition with a huge difference between each patient. can have a different kind of, size, a number of them, the location. So the effect of each tumor, it's very difficult to know exactly specific that what's going to happen in the future. And finally, most of the fibroids do not cause pain or alterations during the cycle. So most of the fibroids are not detected, at least if the patient doesn't go for regular ultrasound checkup. So even though it's not easy to properly confirm the evidence and do a proper studies with the less bias possible, this is what we have. And several meta-analyses have been done to see the impact of fibroids on fertility. Like this one, published by Samigliana in 2021, it is a systematic review and meta-analysis. They first highlight the difficulty to generate research because what we already said. And they highlight that there are just a few studies on this subject that are worth it. So what he shows in this table are the studies where women have fibroids and infertility, and shows that the presence of fibroids is a lot more frequent when the patient suffers from infertility. So they suggest a relationship, but that is not something they can verify or be sure. This may be one of the best studies with the less bias and which has been taken into account in most of the meta-analysis to date when making decision about this topic. It was published in 2006 by Cassini. This prospective control study was performed to evaluate whether the location of the uterine fibroids may influence reproductive function in women, and whether if the removal of those fibers prior to conception can improve pregnancy rates, and obviously how it goes during pregnancy. This study confirms the important role of the location of the uterine fibroid in infertility, and as well as the importance of submucosal fibroids removal before the achievement of pregnancy. And Pritz in 2009 they published this study, and she investigated the effect of fibroids on fertility and myomectomy in improving outcomes. She published this systematic review and meta-analysis. Until this year, in 2009, probably is the best evidence that we have made to make decisions. What she found was that having fibroids without specifying their location, any fibroid, affect the rate of pregnancy, implantation, and live birth, and also increase the miscarriage rate. But she did a subgroup analysis depending on the location of the fibroids, and when only submucosal fibroids was taken into account, this outcome still persists, having less pregnancies, less live birth rate, and also more miscarriages. Analyzing only women with intramural fibroids, they appear to have decreased fertility and increased pregnancy loss compared with women without such a tumor. And subserosal myomas, it doesn't happen. So all fibroids except the subserosal ones affect fertility outcomes. The next question will be if removing them, fertility can improve. So she analyzed fertility outcomes and see that removal of submucosal fibroids seems to confer benefit because increase the clinical pregnancy rates, as you see in the slide, when compared to patients that did not perform the myomectomy. And when compared patients who did the surgery with the patients without myomas, there is no difference. But even that intramural fibroids appear to decrease fertility, the results of therapy are not clear and seems not to improve after surgery. There is an ongoing debate with conflicting results on the impact of this kind of myomas, cavity distorting intramural fibroids, or this natural or even outcomes in IVF. So at this point, we can ask if it is just a matter of the location or if it is a matter of the size or number of myomas that the patient has. So this study published in 2018 included 151 patients with type 3 intramural fibroids and 453 matched control subjects who underwent IVF. And the results suggest that type 3 fibroids are a negative impact on the rates of implantation, clinical pregnancy, and live birth in patients undergoing IVF. So this negative impact of type 3 fibroids is remarkable in women with type 2 fibroids, especially those that were 2 or more centimeters in size. And this study, a little bit more recent, published in 2023, concluded that 2 to 6 centimeter sized non-cavity distorted intramural fibroids have a negative effect on live birth rate and IVF, but apparently those than 2 centimeters doesn't have that kind of outcome. So what about the number? This study published in 2020 showed that when there is 2 or more fibers, there is a significant impact. And also with larger size, the greater the negative impact. And this is the most recent study published just over a month ago, and it evaluates the location, size, and number of fibers, as well as the outcome after the correction or surgery. It includes 13 studies, and the objective of this study was to check the outcome according to their location and also the number of the myomas and also the size of them. And they check after myomectomy what were the outcomes of the patients. So when fibroids were compared according to their size, even when they were small, it was evident that they affect negative effect. And the larger the size, the greater the negative impact. Myomas of any size decrease the pregnancy rate. And when the number was checked, they conclude that when there is more than one fiber, it decreases the clinical pregnancy and live birth rate. But when there is just one alone, it doesn't have a negative impact. So this is the issue. To remove or not to remove? That's the question. So when the outcome is improving fertility, there is no difference. So even that I am a fan of this surgery, hysteroscopy, laparoscopic, or even open surgery, I have to agree that performing a myomectomy for the treatment of intramural fibroids expose both effective patient and doctors to a lot of risk. So benefit should be carefully balanced with the surgical risk because we don't want to make harm to these patients. Laparoscopic myomectomy exposes patients to almost a 10% rate of surgical complications. The main complication includes excessive blood loss, blood transfusion, and even conversion to a hysterectomy. Another possible complication is a well-known formation of both intrauterine and intra-abdominal adhesions that in the future can be associated with severe complications like bowel obstruction and chronic pelvic pain, and also it can decrease fertility in these patients. Long-term complications include risk of uterine rupture in the next pregnancy. It can happen or during labor. It is recommended to wait also after the surgery between 12 weeks and 12 months. And this can expose the patient to age-related fertility decline. And finally, fibroid morcellation during laparoscopic surgery has been associated with serious complications. Therefore, surgical removal of these intramural fibroids, especially the small ones, should not be recommended in all of the cases. It has to be, balanced with the pros and cons with the patient. At the end, take the decision according to what both decides. So when it comes to intramural fibroids, myomectomy should not perform as a prophylactic measure prior to conception. It should be individualized since it's not harmless. But there are several cases where the patient has recurrent implantation failure, recurrent pregnancy loss, or different kind of symptoms like abnormal uterine bleeding, and we can choose to perform this surgery. If for some reason we're going to do the surgery, these are my tips. Do the type of surgery you do best. If it is submucosal, it would be better to perform a hysteroscopy. In these two articles, we highlight that now there is a possibility of mixed techniques that can reduce the risk, save time, and also money. In the one that we published in 2020, you can check the case report and see the video of the surgery for free if you want to. It is very nice and safe, a safe way to resolve small submucosal myomas. And when the myomas are intramural, we have these two options, laparoscopic versus open surgery. A critical factor influencing the choice of surgical approach is first the size and quantity of those fibroids. The open surgery approach is like an alternative to the laparoscopic surgery, but also with very good outcomes when we talk about fertility. So the type of surgical procedure appears to have no significant impact on pregnancy rate. So like I said before, do whatever you think is best and you do best. So there are other alternatives in the management of the fibroids, such as uterine, artery embolization, and ultrasound guide radiofrequency. So far, the results have been good, but we must wait a little bit longer and see whether this could be the best option in some cases. So to sum up, these slides show you the take-home messages. First is that myomas are benign tumors, but despite their benign nature, fibroids can cause a complication related to decrease of fertility. Myomas, even intramural ones, regardless of their size, negatively affect fertility. The larger the fibroid, the greater the negative effect. The greater the number of the fibroids, the greater the negative effect. The closer the fibroid is to the endometrium, the greater the negative effect will be. And the surgical removal of these submucosal fibroids can improve fertility rates and pregnancy outcomes. Until now, the surgical removal of intramural and subserosal fibroids is not necessary to improve fertility outcome, but more research is needed to confirm all of this that I just told you. So if you have any questions, feel free to text me. We'll be glad to help you. Thank you very much.